When it comes to hard plaque versus soft plaque, let's branch off and do each separately.
Yeah.
Is there any chance there for reversal?
I think for both, the answer is yes. I think probably soft plaque, there's more chance than the calcified plaque. But I have patients in my practice now that we are seeing their amount of calcified plaque decrease. Their coronary artery calcium scores are going down. Now, I'm always realistic with people. Let's say you have a CAC score of 500 or 1,000. It's not going back to zero. It might go down 10, 20%. Uh, the natural history, okay, so coronary calcium scans, these have been somewhat prevalent for, 20, 25 years now. So we do have good studies looking at the sort of natural progression over time. And on average, coronary calcium scores tend to go up by 10 to 20% per year. Um, when patients don't progress that much, if they only go up 5% or they go up 0% year over year, we know that that puts them into a low risk category. That patient is unlikely to have a heart attack in the intervening couple of years. So the progression over time becomes an important predictor of the disease. And like I said, we are now starting to demonstrate plaque regression, lowering of both calcified plaque and the non-calcified plaque, because now we have patients that have gotten CT angiograms, the higher fidelity study, on a serial basis, a year or maybe 2 years apart, and we can see both types of plaque can reverse. But I always tell people, as long as we have stopped it from getting worse, as long as it's not continuing to progress, that's sort of what victory looks like to me.
The $1,000,000 question, somebody that gets reversal,
Yeah.
what are you having them do?
Yeah, so all of the things that we've talked about and maybe a little bit more. The primary things we need to do are reverse your insulin resistance if it's present, lower your inflammation if it's present, and we need to optimize the quality of your cholesterol, right? That's not the same thing as saying low cholesterol levels. That's getting mostly large, fluffy LDL particles, little of the small dense particles. That's making sure your HDL cholesterol is high and your triglycerides are low. And we do the advanced measurements. We look at those particle sizes routinely in our patients so that we know what we're dealing with. So lower insulin resistance, lower inflammation, optimize your cholesterol quality. Those are probably the three big pillars. There might be some other things that help. There are some supplements that people talk about, like nattokinase, vitamin K2, nitric oxide, we talked about earlier, right? And if people are low in nitric oxide to start with, then you might want to do something to boost their nitric oxide. That can be something, by the way, like going out in the sun, exercising, right? Those are ways to raise nitric oxide. Or it might be something like taking a supplement that might help you raise your nitric oxide level. So all of these things can start to come into the picture. But again, it all starts with get rid of insulin resistance, get rid of inflammation, and optimize the quality of your cholesterol. And that sets the stage for stabilization at first, stop it from getting worse, and then give the body a chance to heal, and let's see some improvement.
When it comes to a carnivore diet and nitric oxide, how does that, if it does, help with production? Because you often hear eat beets, certain plants can boost it,
Yep.
but talk about it from the carnivore perspective.
I think the way that carnivore really promotes higher levels of nitric oxide is by removing a lot of the things that are damaging, you know, nitric oxide, right? The insulin resistance, the processed foods, the pro-inflammatory foods. So that is one of the things that that is probably the primary reason. Um, um, are there specific components of meat that help make nitric oxide? Yes, There probably are, right? The precursors, right, that our body uses to make nitric oxide, a lot of these things end up being available in meat. Are there some plants that have these things as well? Yes, there are. But again, we could probably get all that we need from the meat. And if we're eliminating the things that are hindering our production of nitric oxide, that becomes a big advantage as well.
You quickly mentioned nattokinase.
Yes.
Explain the mechanism and how that fits in.
Yeah, so nattokinase brings in a whole different aspect of plaque formation that actually we didn't get to uh, talking about today. Um, and that is um, blood clotting. So it turns out that one of the other things that contributes to plaque formation is we start to get they're kind of microscopic blood clots that form. And those can start to contribute to the formation of plaque. And so nattokinase uh, primarily works on the blood clotting system. It increases what it actually does. It's interesting. It doesn't necessarily stop the formation of blood clots, but once a blood clot starts to form, nattokinase increases the body's ability to get rid of that blood clot. That's why nattokinase has been shown to potentially be helpful in reducing plaque formation or even potentially helping with um, existing plaque to lessen. There are some studies that have pointed to this. There might be some limitation to these studies, like they always are, but ultimately, nattokinase has been shown in some trials to help reduce the amount of plaque. Those trials were primarily looking at plaque in the arteries of the neck, not necessarily plaque in the arteries of the heart. But, again, mechanistically, one of the ways that nattokinase is working is by uh, helping the body to break down blood clots so they don't persist and turn into plaque.
When it comes to blood clots, I just want to make the connection there with the plaques.
Yeah.
The way I understood it coming into this is the soft plaques, when they rupture, that's when you get a blood clot. Do I have that right?
So that is one of the situations where you're going to get a blood clot. And those are kind of the bigger blood clots that are actually going to block up the blood vessel and cause a heart attack. But at a microscopic level, again, when we have that damage to the blood vessel wall, right, blood clots become part of, again, that healing mechanism, and starting to fix the blood vessel wall. And those are the kind of microscopic blood clots that the nattokinase really helps to target, so that those blood clots don't become persistent and ultimately contribute to the plaque formation. It's interesting when we look at plaque under the microscope, right? Um, and we see the cholesterol that's there. And one of the hypotheses that has been put forward, right? Understand that our blood cells, all of our cells, but our blood cells being relevant in this aspect, the lining of the blood cell, right, the wall of the blood cell is made up of cholesterol. So, one of the ways that the cholesterol might end up in the plaque is not that it's that the cholesterol that's circulating in our bloodstream. It's that we started with a blood clot, right? We had the red blood cells, the platelets, in that blood clot. Those broke down, and what was left behind was the cholesterol from their walls. And so, that is one of the lines of evidence, that starts to connect blood clotting to plaque formation. And that is one of the reasons that we think things like nattokinase or aspirin is another example, right, of a anti blood clotting agent that has been demonstrated to help reduce the incidence of heart disease.
One thing that comes up for me as you share blood clots and getting rid of those, reversing plaque, whether it be through nattokinase or something else, is poking the sleeping bear. And if things are stable, starting to tinker with that and potential problems that could arise. Any thoughts on that?
Well, yeah, there's always balances, right, in everything that we do. There's always risk and benefits of any intervention that we're thinking of. So, something like blood clotting, you want to find that right balance, right? You don't want to overly impair the body's ability to blood clot because that's to clot because that's going to lead to other issues, and you certainly don't want to be overly promoting blood clotting, right? That's going to lead to certain issues. And it really, the concept in physiology in general, right, is about homeostasis, finding that right balance between too much and too little of a lot of these processes.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
Early on in my career as a heart surgeon, I learned there was a link between oral health and heart health. People that have periodontal disease, those people are at higher risk of having